Good morning. I'm Erin Benham, the Chair of the Legislation and Policy Development Committee, calling our committee meeting to order. First item on the agenda is the approval of our minutes from February. If I could have a motion on that, please.
This is Bonnie, so moved.
John,
Second.
All in any changes to it? Nothing there. All in favor?
Aye.
Okay. Minutes approved. Jessa, I'll turn it over to you so you can introduce Andrea to us.
Sure, thank you. Good morning. I'm Jessa Myrtle. I'm the legal director, as you know, here at the SDE. And during our last meeting, we discussed our bylaws. And in a bylaws, it references the statute regarding the oversight of the State Board of Education. And in that statute, there's reference to preschool. And that led us to a conversation about sort of what is the responsibility of the State Board of Education related to preschool, and where does that responsibility either intersect or depart from the Office of Early Childhood. So I asked for a little bit of time to ensure that we were providing you the right information on that, because as you'll hear today, it's actually not quite as straightforward as perhaps we would have imagined. And so I've asked Andrea Burnell to join us. Andrea works in our Bureau of Special Education, but also has a long history in this field. She's our early childhood consultant and our 619 Part B manager at the State Department of Education. But I'll let her introduce herself so you can hear a little bit more about what her experience is in this area and with the Office of Early Childhood. And then we do have a short presentation for you to just review some of the areas where it's very clear there's oversight and responsibility for the state as the State Board of Education and the State Department of Education, where there's perhaps more clear oversight for the Office of Early Childhood, and then where there is some overlap. And obviously we work closely on these issues. So in preparation for today, we did run this slide set by the Office of Early Childhood to ensure that we were on the same page. And if there continue to be questions or conversations about this, I certainly can request the Office of Early Childhood also come and visit us to provide a little bit more information about what it is that they do. So Andrea, why don't you go ahead and introduce yourself, and then we will begin our slideshow.
Sure. Thank you very much, Jessa, and thank you so much for having me here today to talk about early childhood, because it's just obviously my favorite thing to talk about in the whole world. So my background, as Jessa said, is I do work in the Bureau of Special Ed, where I'm responsible for preschool special ed, but I also have agency-wide responsibilities for early childhood outside of special education. And one of the reasons why I'm able to hopefully answer some of your questions today is previous to this position, I worked at the Office of Early Childhood, where I managed, I think, every grant for state-funded preschool at some time or another during my tenure with them. So I have some background knowledge as to their grant programs. And again, hopefully Jessa and I are able to answer your questions today. If not, I'd be happy to find you answers to anything that I don't know.
Great, thank you. So I'm going to go ahead and share this brief slideshow, and you can let me know if you're able to see it. Are you able to see that? Okay. And if I could just ask everyone to make sure that they're muted if you're not speaking, just might help with some of the feedback. All right, great. So we are here to chat with you, as we said, about preschool and early childhood education in Connecticut. So to start with, and we discussed this briefly last week, the State Board of Education is responsible for general supervision and control over the educational interests of the state, and the statutory language does include a reference to preschool. Connecticut, as you know, does not have mandated universal preschool. So that means that there are towns that as we'll discuss, have taken a different approach than providing preschool to all of their residents. And so there are local boards of education that have voluntarily provided preschool options for all of their residents. And, to the extent that a preschool option is provided that is in and run by a local board of education, generally the state board of education has responsibility for the local boards of education. And so that is a instance where you certainly would have some level of responsibility and oversight. What we're going to discuss throughout this presentation is that there may be instances where it isn't the sole oversight of the state board of education. There may be sort of dual oversight, but I think it's pretty clear that if a preschool program is operated and sort of managed by the local board of education, that is a program where ultimately the local board of education sort of reports up regarding its interest in protecting the educational interests of the state to the state board of education. What we're trying to do in this slide is start to parse out where the Office of Early Childhood comes in. And there are certain child care services that are licensed, and there are certain child care and preschool services that are considered explicitly exempt. And what the statutes describe is that child care services in preschool that are administered by a public school system are explicitly exempt from that licensing requirement with the OEC. And so that is what I was just describing, sort of that those entities that are run by the administration of the local board of education and in most cases housed in a public school. Those are those types of entities that are exempt from the Office of Early Childhood. And then I won't read the slide, but as I indicated, there's sometimes dual jurisdiction. But there are some entities that really the primary responsibility is the local board of education. I don't know if you want to add anything, Andrea. I think we're kind of going to work through some of the specifics as we move on. So I am going to let Andrea, you're muted, so make sure you take yourself off mute, but I'm going to let you take over for this slide because this is her specialty.
Sure. So just because it was mentioned on that last slide, I wanted to let you know that Smart Start is a funding stream from the Office of Early Childhood, but it is a funding stream that only applies to public schools. And it gets sort of tangled when you start talking about all the different funding sources, but that one is specifically, so that's where if you think of us as a Venn diagram with the OEC and SDE, Smart Start is squarely in the middle because it's only funded in public schools. So I am the manager for IDEA Part B 619, which is a sub part of the IDEA, the Individuals with Disabilities Education Act. So we're required by law to provide special education and related services to young children that have been identified as having a disability and require specialized instruction. It has to be, so they are required to get a free and appropriate public education, and it is required to be in the child's least restrictive environment, which for most children, over 80% of children, is expected to be in a general education class or a regular preschool or early childhood program. Special ed and related services are provided, and they're an obligation of local and regional boards of education. And there is overlap as far as there are children who receive IDEA Part B services in state-funded, as part of state-funded spaces that they may be in.
And I just want to add, Andrea, because I think this is just really important to kind of parse out, is that description that you just provided about providing LRE with non-disabled peers is where, some people sometimes have the misconception that the state or that the local Department of Education providing special education services is only providing those services to students with disabilities. But because of those responsibilities, this concept of having the non-disabled peers means that even in towns where there may not be a universal pre-K where all students have access, they are going to have some students who are disabled or need special education and related services, and also some students who are general education students. And that's the case statewide.
It is, and there are many different models of how those services can be provided. So many, or I would say almost all, if not all, school districts in Connecticut have some kind of preschool services within their district where they provide IEP services to children in the LRE. So there are typically developing peers there for most students. Other school districts actually have district staff go out into community-based preschool programs and support children as their least restrictive environment in a community-based program. And just to give you an idea of numbers, I apologize, I have allergies this morning. I just want to preface this with any numbers that I give you today are not unduplicated, which means there's an absolute likelihood that some children are being counted twice because we're not able to tease apart some of those numbers. But just to give you in broad strokes so you can see the size of the population, for the 2021 school year, we have over 5,000 students that are reported in CDAC, in the Special Education Data System, as being either 3-year-olds or 4-year-olds in preschool receiving special ed services. And if we, in 1920, that was over 5,600 students. When I looked at EdSite to see what the total enrollment that's reported for early childhood for preschool in Connecticut, for 19 and 20, it was almost 19,000 students. So public schools are serving more than half of the students that they're serving in preschool programs are not children on IEPs, which speaks to the fact that we do have inclusive programs, which is a really good thing because we know that children learn best from their peers. So that's really good news. And it's been, so this year being an anomaly, just so you know, it's been very stable. I went back to 15, 16, and there have been over 18,000 students reported every year, other than this past year, it went down to a little over 15. But I think, this year's going to be the anomaly for all the data that we look at.
Yeah, Andrea. So the Office of Early Childhood came into being in 2014. And so I think that's one of the reasons why some of the answers to the questions that we had last month are somewhat complex, because, this is not an entity that's been in existence for a long time. And so perhaps some of the jurisdiction is continuing to be worked out as we deal with new factual circumstances. And the intent of the OEC, however, was to simplify oversight, because prior to 2014, the State Department of Education had some additional oversight, the Department of Social Services, Developmental Services, Public Health. There were a lot of different state entities that were taking sort of pieces of oversight over preschool or early childhood. So the intent was to simplify, and we certainly think that intent was met. So OEC, as I indicated earlier, has the charge of licensing childcare programs, and also managing the multiple sources of state funding that Andrea mentioned, and we'll go into that in a little bit more detail, as well as birth to 3 services, and helping to transition students who may have had, or children who may have had birth to 3 services to their role as a student in a public school. And as I mentioned last time, the Office of Early Childhood is, for the administrative purposes, part of the State Department of Education. But as you know, they act relatively independently, and they have their own commissioner, Commissioner Beth Bai, as well as, they are fully staffed to act as an independent agency that has oversight over over early childhood and licensing of childcare programs. And I'm going to let you take this one, Andrea. This is a discussion. One of the reasons we're discussing funding so much is that some of the lines are actually sort of determined by the funding. The individual sort of holding the purse strings tends to be the entity that is taking more oversight and control. So Andrea, go ahead.
Sure. So the OEC has responsible for state-funded programs, and and it's really based on funding streams, as Jess has said, that there are some of the funding goes to licensed child care centers and some that are not run by public schools. So there are instances, and that's what's listed below, of where there is that overlap. So the Care for Kids program is a voucher program, and there are some public schools that do participate in that program. In order to participate, although they are license exempt, schools are required to complete a health and safety inspection, which is, it's sort of, have those health and safety inspections. And that happened I think that happened about 3-4 years ago where that was implemented. There is a Head Start state supplemental grant program. And I actually, Justin, when we made these slides, I actually forgot two entities on here. There are grantees and subgrantees of Head Start, and they're very few. But Enfield, East Hartford, and I neglected to add Manchester, who Enfield is a subgrantee for, and New Haven also. The public schools do have oversight responsibilities for Head Start. The state supplement is only given to programs that have received federal Head Start funds, and I believe there are 23 programs in the entire state. So the subset that are in public schools is relatively small. As I mentioned before, there is Smart Start, and that's always in schools. It's licensed exempt, and that is a really good example of where there's very clear joint jurisdiction over those programs because it's always in public schools. And then there's school readiness, which, as I'm sure you all know, is sort of it is the state's state-funded preschool program. And there is some joint jurisdiction where it does occur in public schools. And I was able to get some numbers for you as far as how many school districts are involved. Keep in mind that these, again, are not unduplicated. So when I tell you how many students are in, how many LEAs participate in Smart Start, there is almost likely that, if not all, most of those students' school districts also have school readiness. So it's definitely not unduplicated. So in school readiness, there are 49 school districts that participate in the school readiness grant program. And that program is governed, the in-between stage between the OEC and school readiness is any of the communities that have the school readiness grant. That grant is governed by a school readiness council, and the grant is jointly held by the school and by the community. So even in districts where they don't have school readiness in the public schools as subgrantees, the superintendent has still signed off on that grant. That grant is jointly held by both entities. So again, 49 school readiness LEAs. Smart Start, there are currently 23 LEAs that participate in the Smart Start program. And I already gave you the Head Start grantees and subgrantees. So Beth, when she was talking about, when she was still a senator and she was talking about the creation of the Office of Early Childhood, used to refer to the spaghetti diagram. And this is the reason why there is that spaghetti diagram, because even with the OEC having purview over early childhood, there's still that overlap and those little squiggly lines that go between the two agencies as far as where they're located and who administers the program.
Well, and I have to compliment you, Andrea, on again, how closely we work with them for that reason, to try to simplify and just ensure that we're not duplicating efforts.
It is, and I have to tell you that there's probably not a day goes by in my work that I am not collaborating or speaking to or messaging somebody from the OEC to make sure that whatever messaging we're using, that we stay on point together, that we're not giving mixed messages out to the field. We work very, very hard to do that. There have been a few missteps because, you know, two agencies working together in a crisis, sometimes somebody drops the ball somewhere, but we do work very, very hard to make sure that it happens. And to be honest, it's really helpful that I did work at STE, and when OEC was created, I went to the OEC, but it's been really helpful because I now understand sort of the workings of both agencies, and I have good relationships with the people over at the OEC. So it's been really helpful with our collaborative efforts, just because I guess because I get where they're coming from and understand the background when we make decisions together.
So this, I think, is our final slide. And just to note, I acknowledge some of this is a little bit of repetition from some of the concepts we touched on earlier, but we wanted to just really lay out some of those areas where there's some overlap. So we could have additional discussion on that if you're interested. Why don't you go ahead, Andrea?
Sure. So it's important to know that, and this always bothers me, Part C comes before Part B. I think it was because it was created later. I have that chronological issue with C does not come before B. But that's early intervention is Part C, which is a completely separate part of the IDEA grant. So the Part B part that I manage is part of the bigger universe of Part B that has to do with 3 to 21-year-olds. And that is sort of inexorably linked with regard to the funding streams that make sense to be together. But Part C is early intervention. There is an overlap between the two where we have shared responsibilities in that transition of children from Part C to Part B. And I work very closely with my Part C counterpart, Alice Ridgway, to make sure that those transitions are as smooth as possible. And we have policies and procedures in place between the two agencies to make sure that all of our programs have a good understanding of what their responsibilities are. And I can give you just a real life example of sort of where that intersection is. When a young child, an infant or toddler, is getting close to their 3rd birthday, Part C is required to have something called the transition conference. So it's their meeting. But in the statute, it requires Part B to participate in that meeting. So that's another point where everybody has their own responsibilities, but the responsibilities are leading to the same work, if you would. So we work very, very closely together, and SDE does have an MOA, a memorandum of agreement with the OEC, because truly, based on the law, school districts are responsible for child find, looking for children who have disabilities from birth all the way through age 21. We actually have an agreement with the OEC through Part C where they actually do child find for us from birth through almost age 3. We start dealing with kids a few months before their 3rd birthday. So we work very, very closely together on all of that. There are also private schools that can have preschool attached to them. And it's as long as they have the grade of K and they're accredited by the approved accrediting agency, which I believe is NIASC or Montessori or the Catholic schools, then they fall into our approved private school bucket. And that is handled a little bit differently. Then there's Smart Start, which we already talked about. And then OEC is responsible for licensing summer camps.
Yeah, and I will say just, and we'll move to questions in a minute, the summer camps is actually, this is one of the areas where I first was introduced to trying to determine some of these boundaries between OEC and the State Department of Education in the context of COVID. We had, again, to Andrew's point, we have a very close relationship with OEC, and I worked very closely with their legal counsel to try to kind of parse out as we were determining some of the changes that might have to occur with summer school. Where was it sort of an SDE rule or a statutory responsibility that needed to be addressed, and where was it an OEC rule or statutory responsibility? And I think in the context of summer camps, it's much clearer when it has to do with those licensed summer camps. But again, those municipal and public school summer camps are not generally under the oversight of OEC. And so we had to try to address some of the rulemaking around that. So we tried to give you really a broad overview of what the responsibilities are between our agency and your board and the OEC. We would welcome any questions, and as I indicated, if there's any additional information that you're interested in, we're certainly happy to either compile that or work with OEC to try to get a representative to come and help us out with some of the questions that might be in their expertise.
Well, thank you, Jessa, and thank you so much, Andrea, for that explanation. Lots of information. I can remember Beth By referring it to as a spaghetti diagram, and boy, is it ever. Like being an educator, I didn't know all these pieces and how much they overlapped as much as they do. I'm going to open it up to the committee, and then Jessa, I'll come back to you to figure out what we need to do with that section that brought this into question. So to committee members, any questions at all for Andrea?
This is Woody. I have a question. Thank you. That was very enlightening. And do we know the percentage of children who enter kindergarten having been in a preschool program?
That is information I can get for you.
I'm just wondering how many, how universal it is, or how broad it is, that as a percentage of the total children in the state. Who are
I do not. I mean, I know I can get you that number.
Okay.
I do know that comparatively, we do better than many other states with opportunities for both 3 and 4-year-olds. There is something that comes out annually called the NIER report, NIEER, in which all states are rated, and it talks about exactly that. So I would be happy to get you that information.
Okay.
Well, and one thing I can say, Andrea, and I just know because we talked about this in the context of declining individuals entering preschool and kindergarten with COVID, that I think the numbers were around somewhere around 18,000, or I'm sorry, kindergarten enrollment in 19 was around 36 or 37,000, and in 2020 was closer to 32 or 33,000. So I just think that gives you a little bit of an idea based on the numbers Andrea provided earlier about the students who are accessing these pre-K services, that we're somewhere around 35,000 students entering kindergarten typically.
Yeah.
But was I being clear? I'm just trying to understand if like more than half the kids in the state go to preschool programs, or only a quarter. Am I being clear about that?
Yeah, and it's more than half. So if we go by the numbers that both Jessa and I have, in 1920 we had almost 19,000 children in preschool, and then Jessa is saying there were about 35,000 in kindergarten.
Yeah.
And I do know that Connecticut, again, comparatively on a national stage, does better than many other places. But I will certainly, I will try to get the most recent copy of the NIER report for you, so you can see sort of that snapshot of Connecticut overall.
Okay. And how many of the LEAs have preschool programs?
I would hesitate to guess that all of them do, because all of them are required to provide IDEA Part B, 619 Part B services. And I'm not aware of any district that is not doing some of that, in their LEA.
What I can tell you, again, based on, I just pulled up the information about the data for students entering these programs. It says that in 2019, public pre-K, so again, that might encapsulate a lot of these different things that we're talking about, but public pre-K, it looked like it was around 18,800, so almost 19,000 students. And then, as I said, kindergarten enrollment in 2019 was around 36,000. So to Andrea's point, that's about 50%. And that's only regarding those entities that were considered to be public school preschool enrollment.
Yeah.
Does that sound right, Andrea? Hopefully I'm.
Yeah. And Jess, I think the state has held that sort of ratio for some time, because it was always such a big thing about we do so well compared to other states, and how wonderful it would be to push it over, that it's every child has that experience versus just a little over half. So, we'll see. We've gotten far, but I know for 5-6 years, certainly it was a big push by our previous governor. Was mandated pre-K, and hopefully we'll get there.
But isn't there still a push on, because not every district even offers it? So I mean, that's the other issue, that you're talking about stats. It's the stats are kind of distorted, because if a district doesn't even offer it, how do you compare apples to oranges?
Right. And it's tough. It's an expensive offering, and we've seen, certainly I've seen over the years in education, pre-Ks being cut and programs being cut because of that. It is something, it's an equity issue, certainly.
It is, and something just to, I guess, to in context, is that districts are allowed to count preschool enrollment as part of their head count as far as the educational cost sharing. The only exception to that is Smart Start students are not allowed to be counted if the district collects tuition. They have to make a choice. They're either going to collect tuition or they're going to count them toward the grant.
That's interesting. Questions from other committee members?
This is Malia. If I could ask a question, can you hear me?
Yeah.
Sorry, my connection, it seems to be unstable, so lots of bizarre things are happening on my screen. I guess I just wanted to sort of piggyback on what Don was mentioning in this conversation, and also tie it back to questions that I think Karen was asking last meeting that led us to this conversation now. But it is that sort of level of complexity of understanding what the landscape is. And to tie it back to Karen's question, it's really a sort of this recognition that we don't really have much information as a state board about just this, right? What are the data? And what does it look like across the state? So disaggregated and not in aggregate form, right? I mean, we know that Connecticut looks seemingly pretty great when we talk about aggregates in just about every category, but that's not what we're actually here to focus on. So really being able to disaggregate that data, have it presented to us, the board, we have a responsibility to these children, and we need to have a better understanding about where are those gaps, what is going well, but what is not going well. And so I appreciate this conversation, and Karen actually raising this with us last meeting, so we as a board can be more informed about that data, about what is going on across the state.
So Malia, something that you said just made me think of something that I'm not sure if you're all aware, Malia, you might be, is that when a school district or any program receives state funding for preschool through the Office of Early Childhood, they are required to meet certain quality standards. So in order for them to get that state money, they have to either be, it's NIAC, the National Association for the Education of Young Children, or Head Start approved. So they either have to be accredited by NIAC or Head Start approved, and they have 3 years from the date in which they receive funding to accomplish that. And then there's interim quality measures that the OEC has. They do environmental rating skills by reliable raters, things like that. Programs that do not receive state funding, so if they receive IDEA funds, which every district does receive some 619 IDEA funds, or they're a district that's just decided to open up preschool classrooms, there really aren't any required quality measures that we have as a State Department of Education. That it's only when we have that overlap between the two do we know that they're NAOC accredited or Head Start approved. Otherwise, they meet whatever standards the school has set for them to meet.
Okay. Bob, you have a question?
Yeah, I do. As I recall, there's in kindergarten, they do kind of a readiness evaluation on a child. Is that correct?
We do have a kindergarten entrance inventory, the KEI, that is required across the state. Over the past several years, there was some work that was done on revising that. Our current KEI is based on our preschool assessment framework and our preschool curriculum framework, which we no longer use. We have the early learning and development standards and the DOTS assessment. I am not aware where that work stands right now, but that was something that was, again, another intersection between the two agencies, but it wasn't a project that I had worked on myself.
Okay. So it seems like, knowing what the results of that would also tell you, what percentage of, regardless of the program the child comes from, or it could tell you the quality of the programs they're coming from, is, whether how they do on that, I can't remember your acronym, but, the readiness readiness thing that they do when a child enters kindergarten?
So the KEI as it stands right now is intended to be a statewide snapshot. And it's not meant to be used to be aggregated down to connect to, a child went to Miss Pitty Pat's preschool and this is how they did on the KEI. Therefore, we can say it's effective or not effective. So that is information we don't have because that isn't the current intention of that KEI.
But should it be though?
Personally, world according to Andrea, I think we would need to revise the KEI because we're not even teaching to those standards anymore. We're based on the ELDS, on the Early Learning and Development Standards, which are aligned with the Connecticut Core Standards, which there is a difference from the preschool curriculum framework. So I think we would need to make sure that whatever tool we are using, we design it for the purpose that it's intended. So if it's intended to look at kids who have a preschool experience and how they arrive at kindergarten versus that statewide aggregate snapshot.
Yeah, I think to Malia's point though, if the more if you can get something that makes sense, from an education standpoint, it would also give you an idea of where the holes are in terms of different communities across the state. Who's got kids that are ready and who doesn't, and then that you can step up the interventions in those communities that are not have kids that are ready. That makes sense.
It does. I think it makes sense. I always wondered, Andrea, why the KEI was not aligned or revised, I guess, because it's been that way for quite some time, hasn't it? The way it is presently.
Yeah, I believe it was probably around 4 years ago. Connecticut was involved with a consortium to do the revisions. And I think and that actually, my understanding is it wasn't legislation that the OEC was to design it and that we were to implement, but they did work together and work with a consortium. That would be, Jeet, I know, was working on that. So that would be a question as far as, I'm not sure where that stands now. Certainly if it, because of where I'm sitting right now, if it does rise again, I would love to be able to, provide input to that kind of a project, but I'm honestly not sure where it stands right now.
Okay.
It sounds like we should go back to probably Jeet and maybe see if we can collect some additional data to get at some of these questions around universal pre-K or better access to pre-K. Sort of what does that look like? How does it create better opportunities for our early childhood students? And, I also just want to acknowledge, I hear you, and I think Andrea and I and some of our leadership can talk about the fact that, it sounds like there's a little bit of a thirst to better understand, particularly the areas of preschool that are under the oversight of the Board of Education. And I know Andrea and I have discussed that now Secretary Cardona was very, clear that that is a really important part of what we do and that it shouldn't be something that is, it should be something that you're being provided information and data on. So why don't I go back to our leadership and Andrea and I can discuss how we get better access for you folks and maybe if there's a presentation that's appropriate in the near future.
And when you say a presentation for the entire board.
That's what I'm understanding you're requesting.
Yeah. I would suggest that. That being said, though, this whole thing came up with that section in our bylaws. Is that I'm at a loss here of do we need to make changes to how that's stated, or is this serving as an understanding of how it's stated? Do you know what I mean? Like, I don't think we could explain it in our bylaws of what clearly that it would make any sense to anybody that was reading it. But it would be a good thing to have the entire board understand that piece of the bylaws, why preschool is in it, and how it is represented.
Yeah, I think, I noted last time that it's actually part of the statutory charge for the State Board of Education, but I think Board Member Du Bois-Walton mentioned this last time, we should probably clarify in the statute if we're trying to parse out sort of where is the responsibility. And so I can also talk to our legislative liaison and maybe to the attorneys in my office to brainstorm, because it's not just about, you know, the bylaws is essentially just a repetition of what's in the statute. And I certainly understand even if we just alluded to sort of oversight of those areas where OEC is not, you know, does not have oversight or something like that. It might not be easy to articulate all of the differences, but we could certainly think of some language. Obviously, I will consult with you, Andrea, some language to just articulate what is currently the status for oversight.
Yeah, that's what I would suggest, that something be added there, that what actually is included.
Aaron,
Yeah,
ask
Bob?
one other. Yeah, I think when you present, especially even back here, and especially to the board, is there are probably some. I think kids who go to preschool do better in school, right? At least that's my understanding.
I'm guessing.
I
would guess.
Yeah, you hope so.
Yeah.
So so like the correlation, it's the correlation between having a quality preschool experience and being ready for kindergarten. What does that mean for a child's performance in elementary school?
Right. So maybe it would be helpful for us to articulate also some of both statewide and national research and data on the importance of equitable access to quality preschool programs and what that means for setting up children for success.
Yeah.
Exactly. Thank you.
Sure.
And you're absolutely right. There is a lot of research out there showing why preschool is important. And there was actually, I don't know if you're familiar with the Hechinger report. It's considered old news now, but it was showing that there is, a huge financial incentive in the long run for us to provide high quality preschool. And that's, I guess, considered one of the seminal pieces of research out there that people go back to all the time when they're talking about investments in early childhood.
Yeah. Any other committee members have questions? Yeah. Bob, I still see your hand, but I'm thinking, is that your old hand?
Oh, yeah.
Just didn't want to make sure. Okay, so
My hand.
Woody.
We know if there's a disparity in early childhood programs between cities and other parts of the state, or whether some children have more access than others in different areas?
So we did do a study when Smart Start came into effect. The way the legislation was written is that we had to figure out where there was a need for additional preschool. So we did have, I'm going to forget their name, the agency that does the financing for schools, and I'm just blanking on their acronym, CHIFA. Sorry. So we did have CHIFA do an actual study for us, and what it showed was pretty much there was room for additional preschool in the entire state, and the only exception to that, based on what was set as the standard for Smart Start, was New Haven. And even New Haven, when you speak with them, they talk about there are deserts in certain areas of the city, that they might have an aggregate number that's pretty high, but that there are still pockets within the city where there may not be enough access. So I think, again, Connecticut does well with what we offer, but not every child has the experience in Connecticut.
Okay. Anyone else before we wrap it up? Okay. Well, thank you so much, Andrea. And I think we'll be seeing you again based on this conversation, but this was great information and help us get through this. And I think it's an eye opener for some of us on how in depth this actually goes. And Bob, I like your suggestion of going into it deeper, getting Ajit involved, and also going to the full board with this information, because I think it is important for us to know more about this. So thank you so much for putting this together for us, Jessa and Andrea. And that being said, we can adjourn. I'm hoping I see some of you in Hartford later. Those of you coming to Hartford, I have your mugs. So And if you're not going to be there, I will leave them with Anne Marie. She has graciously said that she will house them until you are back. Okay, so hopefully I'll see
Thank
something
you.
else one way or another. I'll
Thank
see
you,
you all a
Andrea.
little later. Jessica,
Thank
good
you,
luck.
Andrea. You're a superstar, so we really appreciate it. I'll be in touch
Thank
Erin,
you.
about our next charity.
Bye-bye.
Thanks. Have a great day.
Bye-bye.
See you